Hello guys, welcome to the live lecture. Can you all hear me please? Just someone of you text in the live chat so that we can start. Because after a long time I'm going live. So we'll wait for some time and check the audio and let all of you come. So good afternoon everybody. Tulsi, Anu, Deepshika, Mrinal. So all of you please be online and active in the chat, in the live chat. If some questions are there, you can ask us, and if I ask you some question, please be active and answer in the comments. In the live chat you can comment. So we'll wait for 2 or 3 minutes more so that all of you can join. Is the audio okay? Everybody can hear me? Mrinal, can you hear clearly? Deepshika, Satish. Yes, good afternoon everybody. Can you hear the audio? Okay, so Mrinal says I'm audible. Okay, so guys, today we'll be discussing about hematopoiesis, and this is a very important topic if you want to become a good doctor, a good physician, or a good hematologist or an oncologist, and more of hematologist. And this lecture is very important because we have to know the basics, how the Rbcs are formed, how the WBCs are formed, how the platelets are formed, where are they formed, before birth and after birth, where are they formed. So it is very important, and we have to know what stem cells are and what is the importance of stem cells. And from that point of view, it is a very important topic. So today we'll be discussing about precursors of hemopoiesis. So hemopoiesis, some people call it hemopoiesis, H-E-M-O, hemopoiesis. Hemo is blood, poiesis is making of. So making of blood or RBCs or WBCs or platelets. These are the main three cell lines which are formed in the bone marrow. So we have still half of the class has joined. Please tell everybody to join. And so that is basically hemopoiesis, and how these cell lines differentiate, how they start from a single common cell, and how they differentiate into further specialized cell lines, and all those things we'll be discussing. So some people write it as H-A-E-M-O, hemopoiesis. So it's the same word. So, but you should know in America, they call it like American language accent, hemopoiesis. In UK, they would call it H-A-E, hemopoiesis. Thanks, Taslima. So we will start, just concentrate and focus, spend 1 or 2 minutes on this chart. It is a very important chart. And in this, it basically tells you how the cells are formed in your body, in your bone marrow, and how they differentiate into further specialized cells. They start from one single cell, which is a stem cell. It is a multipotent hematopoietic stem cell. Some people also call it hemocytoblast. And this stem cell, it can basically differentiate into any other cell. Okay, and there are various conditions or factors and stimuli which will determine, which we call it as niche in the bone marrow, which determine which line the cell will follow. Okay, so this multipotent hematopoietic stem cell, it will first divide into basically two two progenitors, common myeloid progenitor. So if you can see, this is the common myeloid progenitor. So you have to remember this word myeloid, okay, and common lymphoid progenitor. So this you can see lymphoid, okay. So to make it easy, forget this part first. So basically the lymphoid, it will divide into natural killer cells. It will form large granular lymphocytes. You can see this is large lymphocyte, and it is granular, okay. Then there are small lymphocytes. So they further divide into T lymphocyte and B lymphocytes. The B lymphocytes will further mature and form the plasma cells. And sometimes you must have heard multiple myeloma. So there are various tumors which can affect the hematological system, and leukemias, and also anemias. And you must also keep in mind, sometimes your patient will present to you with anemia, but he might be having a leukemia, okay. So it is very important from this point of view. It is very important that you should know in detail when you're looking at the peripheral smear of the patient, or if you're reading the peripheral smear picture report, you have to look for different cells which are the warning telltale cells, okay. Look for blasts and blast cells and other precursors of normal hemopoiesis. So it is very important, okay. So see, common myeloid progenitor, basically it will divide into a large granular lymphocyte, which is a natural killer cell, and a small lymphocyte, which is further divided, which further differentiates into T lymphocyte and B lymphocyte, and B lymphocyte further goes and forms plasma cells. Now we come to common myeloid progenitor, okay. So this further divides, has further cells, and basically one important line is which forms the platelets, okay. So there is a megakaryocyte which further divides and forms into platelets. Then there are erythrocytes, okay, very important. Then myeloblasts are there. So they will further divide into basophils, neutrophils, eosinophils, monocytes, and they further will form the macrophages. So this chart is very important. You should, anyway, I will upload a link to this PowerPoint after some time. Once this lecture is over, I will put the link in the description. You can download this. So no need to take snapshots, and I will send you in WhatsApp also if you want it. Okay, so now we know hematopoiesis, it is a Greek word, okay, and in Greek also basically same thing. It means blood and to make. So the process of making the blood is hematopoiesis, and there are different cellular components which we'll be discussing in detail. So all cellular blood components, they are derived from hematopoietic stem cells. We'll be abbreviating this from now on. HSC will be calling hematopoietic stem cells, okay. Then in adult person, you require around 10 to the power 11 to 10 to the power 12 new blood cells daily, okay, for normal peripheral circulation of RBCs to be maintained. And if supposing there is increased blood loss or decreased RBC formation, or the demand of the patient increases, like the person becomes pregnant and then the demand for RBCs is more, then you might become anemic if your bone marrow is not working fine appropriately. So it is very important to know this. So at this point also you should remember there are reticulocytes, retics, which are precursors and immature RBCs, and they'll be formed in the bone marrow. So whenever there is stress on the body and more oxygen demand is there, more HB is required, oxyhemoglobin is required, then the reticulocyte count might rise. And especially in acute blood loss conditions, the retics will start rising. Also, you have to monitor the Reticulocytes, when you're giving iron therapy or B12 therapy to an anemic patient, after 2 to 3 days, their retics will start responding, provided the bone marrow is functioning normally. Okay, so now you say this. This is the structure of the bone. All of you have gone through these slides in your anatomy, and this is the cortex of the bone, and this is the medulla, and this is the nutrient artery, which is forming a radial artery going into the cortex, medullary artery. Then there are endosteal capillaries penetrating inside into the endosteum and perfusing the cortex. So all the cells are formed out here. So you can see here hemopoietic cell precursors, they are all lying here in the matrix, in the marrow. Okay, but you must know this, that bone will start producing blood late in pregnancy, in the fetal life, and after birth it is mainly the bone where the RBCs and other cells will be produced. When the fetus is forming, there are other organs. Okay, so we'll come to that slide later on. So all blood cells, they are divided into 3 lineages. So you have RBCs, WBCs, and platelets. Hi Vinci, good afternoon. So there are erythrocytes, erythroid cells. These are oxygen carrying RBCs. And there are precursors, you can say. They are immature RBCs, which are called reticulocytes. And they are also carrying oxygen for distributing into the different parts of the body. So like whenever you are exercising, more oxygen is required. You are cycling, more oxygen is required. So in these conditions, your retics will start rising. And to stimulate the reticulocytes, there are different drugs which can cause erythropoiesis, and the retics will rise, and the stimulus will come from the brain. It will tell the marrow there is stress, we need more oxygen for the muscles, they have to run. So fire these reticulocytes into the peripheral blood system and let them deliver the oxygen. So they are like police cars which are parked inside the bone marrow, and then they will just gush into the bloodstream and satisfy the deficit. So reticulocyte basically will tell you what is the rate of erythropoiesis, how the RBCs are, how fast the RBCs are formed. And I told you, like when you're giving hematinic therapy, you're giving iron, folic acid, B12 to the patient, and you want to see the response. You want to monitor the response of your therapy in that patient. So you will look at the reticulocyte count. But you also have to know that retics will rise only if the bone marrow is appropriately functioning. Then the next line is lymphocytes. They are the cornerstone of your immune system, adaptive immune system. And whenever you are exposed to an allergen or an antigen, and your lymphocytes will analyze the stimulus, noxious stimulus, and they will form some antibodies, and that goes into the memory. And then whenever you're further again infected with the same insult, same antigen, so these lymphocytes will make a shield and try to destroy the antigen by making antigen antibody complexes. But they are not very intelligent. In the bargain, they will destroy some healthy cells in the body also, like in COVID, So actually the COVID virus is not it's not the virus that is going inside and killing you in any other condition also, but it is your immune system. It goes crazy and it just starts destroying everything. Like in autoimmune diseases also it happens, autoimmune hemolytic anemia, SLE. So it is very important to know about this lineage also. So this lymphoid lineage, it is primarily composed of T cells and B cells. They are also called white blood cells. I'm sure you have read all this in anatomy and physiology. This is just an introductory lecture in medicine. and after this we'll start talking on anemias and different types of anemias and leukemias and other diseases of the blood. Then there are myelocytes. They include mainly granulocytes, megakaryocytes, macrophages. So they are also important cells which help fight infection. They offer you innate immunity, adaptive immunity. They help in clotting. The platelets will help in clotting, and whenever there is a injury inside the endothelium, on the endothelium in the blood vessel, on the vein, so these platelets, they will go and make a plug there and try to stop the bleeding, prevent the focus of infection to spread. Okay, so that can be good also, and sometimes it is bad also. Then what is granulopoiesis? So it is the poiesis of granulocytes, hematopoiesis of granulocytes. So it's very important. It's very easy to remember. Poiesis is making, and the prefix is the cell name. Okay, so granulopoiesis, megakaryocytopoiesis. Okay, formation of megakaryocytes. So this is a chart showing the different cell lines. So you can read this in your PowerPoints. You can download from the description. Okay. Now, what is multipotency and self-renewal? So in the beginning of the lecture, I told you that hemopoietic stem cells, they are, to begin with, they are multipotent. So they can, that same cell can finally take the form of a RBC or a lymphocyte or a platelet, the end result. Okay, so it's not that one particular type of HSC, hemopoietic stem cell, will form only into megakaryocyte, into platelet, or into RBC, or into B cell. So they can form any type of cell. So that is why they are called multipotent. And one more quality of these hemopoietic stem cells is they can self-replicate. So it's not that all the hemopoietic stem cells, they will transform into one of the lineage, myeloid or the lymphoid lineage. Around 50% of them, they will just turn over and replicate, and they will form more of hemopoietic stem cells. So that is how, otherwise there will be no stem cell left. And this funda is used in bone marrow transplant, because in bone marrow you are injecting limited amount of stem cells into the body, and then they go and they start multiplying into bone, into more hemopoietic stem cells. Then of those, a few of them divide into further differentiated cell lines. Some will form RBCs, lymphocytes, platelets, megakaryocytes, and all those things. And this function, this feature is used in bone marrow transplantation. So that is why bone marrow transplantation is successful. So you just inject, and then further more and more cells will automatically keep on forming. But there is always a but in science. Okay, so stem cell self-renewal, it is thought to occur in the stem cell niche, which is in the bone marrow. So niche is basically an environment in which the multipotent stem cell will decide whether it has to form into an RBC or into a lymphocyte or a platelet, and that stem cell niche, that environment, that stimulus there, and that requirement of the body to form that cell. So these things will regulate formation of different cells. So there is a lot of interest of scientists in understanding what are the things, environmental factors, which are part of this stem cell niche, what governs the division, the formation of the stem cells into further specialized progenitors. Because if you come to know this, you can clone and you can make artificially stem cells, and more patients can benefit. Okay. So as an understanding, so because a lot of patients, they need bone marrow transplant. So patients, children with leukemias, thalassemia, sickle cell, and so many genetic disorders. So they might benefit from bone marrow transplant. Now we come to different colony forming units. So you call it CFU. Okay. So basically whichever colony is being formed, you put a hyphen and a L and the alphabet. So CFUL, colony forming unit for lymphocytes, colony forming unit for erythrocytes. So CFUE. Okay. Then colony forming unit granulomonocyte. So CFU granulomonocyte. Then colony forming unit macrocyte, ME. Colony forming unit basophil, CFUB. Then CFUEO, eosinophils. So these are the different CFUs, and they're based on the different lineages which can be there. Then there is a special type of colony forming unit which is called CFUS, colony forming unit spleen. Okay, so it was the basis of in vivo clonal colony formation, and it depends on the ability of infused marrow cells to give rise to clones of maturing hemopoietic cells in the spleen of irradiated mice after 8 to 12 days. So it's more of a research thing, and it was used extensively in the earlier studies, but now it is considered to measure more mature progenitors or transit amplifying cells rather than the stem cells. So where do these cells reside? So hemopoietic stem cells, HSC, they reside in the medulla of the bone marrow, in the bone, medulla of the bone, in the bone marrow. And they have the unique ability to give rise to any type of mature cell type or tissue. So it is like they can differentiate into anything. Now, two characteristics of HSC I have already told you. They are self-renewing. They will form more of HSC, and some of the HSC they will form daughter HSCs. That is myeloid and lymphoid progenitor cells. So these are daughters. Okay. So, however, you must understand the daughter series, the myeloid progenitors and the lymphoid progenitor cells, they cannot self-replicate and form more of myeloid progenitor or lymphoid progenitor. So once they form into myeloid or lymphoid progenitor, they have to further specialize, subdivide, specialize, mature into something for which they are destined to. So that is a characteristic. So they cannot form more of their own cell type. So once the hemopoietic stem cell divides into, let us say, myeloid progenitor cells, it will form a RBC or a platelet or something like that. If it divides into lymphoid progenitor, it will form a plasma cell or some large lymphocyte or something like that. So this is very important. They cannot self-renew. So they are dependent on from the back end. Back end is hemopoietic stem cells. So then hemopoietic stem cells, they are also found in the umbilical cord. So you must have heard we have cord blood banks. It's a big business, and as soon as the baby is born, these guys, they might approach you and ask you, do you want to preserve the cord blood of your child just in case he suffers from some irradiation or he develops a leukemia after 20 years, and from the cord blood we can just reform his stem cells. So this is a thing to be thought about, and it's a very upcoming science, a very costly affair. So stem cells or progenitor cells, they can be taken from the pelvis. So you basically do a bone marrow cytology aspiration and cytology, biopsy you take. Okay, so it is done with the needle and a syringe. So this is how the bone marrow, this is not for the weak hearted, this picture. So, but anyway, you will have to do bone marrows, and it is for the good of the patient. Just make sure your patient does not have pain. Okay, and all of you who have who attend my classes or rounds with me, you know I am very much against pain, causing pain to my patients. Not extra medicine goes IV into my patients, and no extra pain than is needed is induced. And you should be like that. You should be very compassionate. So this is, and the patient is anesthetized, local anesthesia has been given, and these are the bone marrow aspiration needles, and at the iliac crest posteriorly, usually posteriorly we take, and you infiltrate the skin and the subcutaneous tissue and the periosteum even with xylocaine, adrenalinized xylocaine. So there is no bleeding, much of oozing, and you definitely have to check the patient's PTINR and the platelet count. It should not be very, very low or very much deranged PTINR, otherwise they will not stop bleeding. So all these things you have to make sure. If it is less, you give RDPs or STPs or FFPs, or if cryo is needed, you can give that also, and then you do the procedure. So you go till the periosteum, and you have to explain nicely to the patient, because if the patient is anxious, he will move. Even the pressure he will sense as pain. So you have to tell the patient, like, there will be pressure, we'll be forcing things, but you will not have pain. And little bit of pain, then they will tolerate. By that time you have already aspirated. Okay, and especially when you aspirate, the bone marrow aspirate, it creates a suction, negative vacuum inside, and that actually is painful. But then the patient will understand, and he will forgive you that some pain was induced, but that is for patients good. So bone marrow aspirate just looks like blood, and then you take it on peripheral slides, glass slides, and the hematology team will be standing by you, and you give it to them. Then they will analyze, they will see it against the light, and they will see there is bone marrow aspirate in that, and then they will make slides. Otherwise they will tell you to take it again. So this is being done on both sides. So I presume the patient has been given a GA or something. So I will try to play this video if it plays. Okay. So just watch this video. It's just
the
a 4-minute
procedure
video.
starts by finding the correct level for the biopsy. The biopsies are taken from the upper iliac crest with access via the ventral spine. The midline of the spinous process is identified, and the iliac crest is located by palpation.
So I just took this video from
When the correct point is found,
oncolex.org.
the puncture point is marked
All the
using a
credit
straw.
goes to them.
This is to avoid losing the marking after washing. The area around the puncture point is washed with colored chlorhexidine. The procedure is carried out aseptically, but without sterile drapes. The area around the puncture point must remain sterile during the whole procedure. Correct placement of local anesthesia is important for how the patient experiences the procedure. 10 milliliters of xylocaine with 10 milligrams per milliliter of adrenaline is normally used. When the needle reaches the periosteum, the anesthesia is given time to work before the numbed area is expanded by angling the needle in 4 directions.
So this is the right way to give the anesthesia.
To avoid unnecessary trauma to the skin from the aspiration needle, a small incision is made in the skin with a scalpel blade. Disposable and reusable aspiration needles are available. A reusable needle is used in this video. The needle is pushed toward the posterior iliac spine and rotated with careful pressure until it goes through the cortex. When the needle is in the spongy tissue, the trocar is removed and a 5 milliliter syringe is connected to the needle. 0.2 to 2 milliliters is quickly aspirated for a regular bone marrow smear. 3 small and 7 larger smears are placed on slides. The slides are tilted, and the blood, which collects in the lower edge of the smear, is removed before it coagulates. We then use another slide to make a few regular smears and some which are squeezed.
So once you people
The
will
smears are
become
dried with a
interns, you'll
fan
be
before fixation and
you'll be doing
staining.
these bone marrows under guidance.
A new aspiration needle is used for aspiration for flow cytometry. 0.5 milliliters of monoporin is placed in the syringe in advance to stop the aspirate coagulating. 4 to 5 milliliters is aspirated with the syringe. The aspirate is quickly moved to a specimen glass. Finally, a punch biopsy is taken. A disposable needle is used. The needle is inserted in the same puncture wound and pushed toward the posterior crest. The needle is rotated with constant pressure until it penetrates the iliac crest. Care is taken to ensure that the needle does not slide into an area that is not anesthetized.
So you should have a good control over the
The
needle.
trocar is removed from
Hold
the
it
needle.
very nicely and firmly.
The rotation of the needle is continued until it has penetrated deep enough into the bone marrow. The spoon is inserted into the needle. The biopsy needle is rotated without pressure in both directions to cut the biopsy loose. The needle with spoon and biopsy is pulled out. The spoon is carefully removed from the needle, and the biopsy is put in fixation
So
fluid
this is a
using a
very
blunt trocar.
precious piece of tissue.
The incision is closed with strips and covered with an adhesive bandage.
So this is how the bone marrow aspiration is done and the bone marrow biopsy is done. And you have to be very, very gentle but very fast. Don't cause an inch of extra pain to the patient, but some amount of discomfort might be there if your patient has not been given a proper anesthesia. Now, this is just a slide which I put because it's always good to encourage others, and you have to set an example so that others can follow. We just can't preach and not do the same thing. So I became a bone marrow donor in January 2019, and this is my digital ID card. And I'm just waiting for the chance that God uses me to save some child or somebody somewhere, and I can give my bone marrow or my blood so that some person can be saved from deadly leukemia or thalassemia or some sickle cell or some fatal disease for which bone marrow is the only answer. So bone marrow transplantation, you can take the stem cell therapy basically. So you can take from the marrow, but nowadays they can just take 1 bottle of blood from you, and there are stem cells in that also. And before that, they will give you GCSF, granulocyte colony stimulating factors, and that will stimulate the bone marrow to produce more of the stem cells, and more will be released into the peripheral blood. So this is a take-home message for all of you. I have signed up myself at datri.org, datri.org, and it is basically a registry of people who are willing to be donors of bone marrow stem cells. And if someone approaches them and he needs he's compatible with your bone marrow, and your stem cells can work in him, they will give you a call. And it is very, very easy. You just write to them, give them the details that they want, and they will send you 2 test tubes with 2 buccal swab smear sticks, and you basically have to just scrape the inside of a buccal mucosa and give it back and send it back to them. And That's it. And then once the analysis is done and your typing is done, so you'll be on the registry. So isn't it a good thing that you can save a life? So I suggest that all of you should go to this site, register yourself, become bone marrow donors, become stem cell donors, and help give life to somebody. So like I said, once the person has been mashed properly and you have to collect his bone stem cells, so they are injected with the cytokine, something like granulocyte colony stimulating factor, GCSF, and that will induce the cells to leave the bone marrow and circulate in the blood vessels. So from there they can further amplify and take the stem cells. In mammalian embryology, the first definitive hemopoietic stem cells, they are detected in the aortogonadomesonephros. So all of you have done anatomy. I'm sure you understand nicely what this means. And then they are massively expanded in the fetal liver. So now you will ask, sir, why not the bone? Because bone forms after some time in the fetus. Okay. So first is the yolk sac. So in the yolk sac is basically the area where all these stem cells and RBCs will form, your capillaries will form, and your arteries, veins, and aorta, they will start from the yolk sac. Okay, and then further there is further division. So this is a nice nice picture. So you can see along this axis, this is the duration, fetal life after birth, and out here is a cellularity. Okay, so from 0 months to 3 months or 2.7 months, it is just the yolk sac, okay, which is forming. It is the highest, then it starts slowly coming down. Then at around 1 month of age, the liver starts forming your blood cells. Then also spleen starts forming at around 2.4 months. Then at around 4 months, the bone marrow starts forming the stem cells and marrow. It's not that the bone marrow starts forming the stem cells. The stem cells, they reach the bone marrow, they populate it, and then further divisions occur in the bone marrow. That is a better way to put it. Okay. Then these are the different areas in the human body, bones, where you will find a succulent marrow, and most stem cells are available. So in the vertebrae, in the pelvis, age-wise, okay, as the age is progressing, everything is coming down. So sternum, ribs, femur, okay. So in developing embryos, blood formation, it occurs in pools, okay, in aggregates of blood cells in the yolk sac. So these are called blood islands. And then it further divides into your capillaries, arteries, veins, and pure cells. So as the development progresses, blood formation starts occurring in the liver, then in the spleen, in the lymph nodes. Then the bones form, bone marrow forms, and eventually they are populated with stem cells. So maturation, activation, and proliferation of lymphoid cells, it occurs secondarily in the lymphoid organs. So what are the lymphoid organs? Spleen, thymus, and lymph nodes. So you see, these are all important. Every organ is important in your body. So in children, hematopoiesis occurs in the marrow of long bones such as femur, tibia. In adults, it occurs mainly in the pelvis, cranium, vertebrae, sternum. Sometimes they take sternal biopsy also, but you have to be very, very careful when you take a sternal biopsy, sternal aspirate, because sternum is not very thick, and if you exert too much of pressure and you bypass and you go through and through into the sternum, you can cause a lot of damage to the major arteries and veins out there, even to the lung and pleura. And in some cases, liver, thymus, and spleen, they may resume and start forming the hemopoiesis. So this is called extramedullary hemopoiesis. So basically, whenever the workload on the body of forming of requiring more of these cells is there, and bone marrow cannot provide enough, so then extramedullary hematopoiesis starts, like in thalassemia, because the body thinks like not enough oxygen is reaching the cells, although there might be enough cells. Okay, so the cranium, hair on end appearance, you will get a lot of extra Myelocytes, extramedullary hematopoiesis will start occurring in the liver, in the spleen. They will have splenomegaly and things like that. So during fetal development, since bones and bone marrow they develop later on, the liver functions mainly as a hematopoietic organ. After that, in the latter part of fetal age, 7-8 months, so there the bones they will take over. So this is different. These are different cells. You will just spend 1 minute on the different cell types. So this is a segmented neutrophil. There are multiple segments. Usually there are around 3, 4, 5 segments. This is a big myeloblast. Now, next we come to cell differentiation. What is determinism theory? So there is something called as determinism theory of hematopoiesis, which says colony stimulating factors and other factors of hematopoietic microenvironment, they determine the cells to follow a certain path of cell differentiation. Okay, so it is a niche. Okay, so what type of an environment is there? Like it is something like we are sitting and nice music is playing, and then you will start enjoying. Okay, and if there are people fighting around you, and you will also obviously get upset. So it is something like it's the same person but behaving differently. So this is in simple words what the theory of determinism is. So it is what effect your surrounding is making on the cell differentiation. So it is the ability of the bone marrow to regulate the quantity of different cell types to be produced, and it is more accurately explained by stochastic theory. So in this, there are undifferentiated blood cells. They are determined to specific cell type by randomness. So actually, there is a microenvironment which will govern what will happen, what will form. So we say, okay, they are totipotent, they are multipotent, but the environment will affect the multiplication, the further specialization of the cells. So the hematopoietic microenvironment, it prevails upon some of the cells to survive, while the same environment will force other cells to undergo apoptosis and they will die. So self-death of the cells, okay, that will occur. Then there are transcription factors. There are growth factors. They will induce some signal transduction pathway. They will initiate it and they will alter the transcription factor. So in short, growth factors, they will activate certain genes and which will further determine the differentiation of the blood cells. So this is very important. You should remember this. The early committed progenitors. So when from the multipotent stem cell, you divide into myeloid and lymphoid series. So they are less susceptible to these environmental factors. Okay. Which cell lineage is selected for differentiation may depend both on chance and on the external signal received by the progenitor cells. So what are the different transcription factors? So there are many, and there are many transcription factors. So PU1, it commits cell to the myeloid lineage. Then GATA1, it has essential role in erythropoietic and megakaryocytic differentiation. Then L-Kairos, Ailos, and Helios transcription factors, they play a major role in lymphoid development. The proliferation and self-renewal of the cells, it depends on stem cell factor SCF. There are glycoprotein growth factors which regulate the proliferation and maturation of the cells that enter the blood and form the marrow, and they cause cells in one or more committed cell lines to proliferate and mature. We are just 2 or 3 more slides, so please hold on. So there are 3 more factors that stimulate the production of committed stem cells. This is an important slide, please pay attention. And they are called colony stimulating factors, CSFs. And this includes granulocyte macrophage CSF, so GM-CSF, then granulocyte CSF, GCSF, because many times you will be giving chemotherapy to your patients, and these patients, they will develop neutropenia, and the absolute neutrophil count will be very, very low. It may fall as low as 250 or even 100 or even less than that. And that is a very, very fatal condition. These patients can develop very bad infections and they may not recover because the immune system has been hit by the chemo which you gave to kill the bad cells. So in that case, we give granulocyte colony stimulating factors, and then the bone marrow starts functioning again. Then there are macrophage CSF, MCSF. These will stimulate the granulocyte formation, and they are active on either progenitor cells or the end product cells. Then your kidney produces erythropoietin. So it is produced in response to hypoxia, and it is required for myeloid progenitor cell to become an erythrocyte. Now, what is important about erythropoietin? It is also called synthetic erythropoietin. You get here also for therapy in chronic kidney patients, and EPO we call it, or YPOX by the name of it comes. And many of the endurance runners, and they can misuse, they have misused this drug, and like Lance Armstrong, so he is 7 times Tour de France winner. So that race is uphill, and for 3 weeks they cycle, and it's a very tough and rough race. And his team used to take erythropoietin, EPO, and other hormones and all. And even while they would take a pee break inside the bus, they would transfuse blood, which he confessed on Oprah Winfrey show. They would transfuse EPO to stimulate more fresh blood cell formation. And while they're racing, they would take a blood transfusion at the pretext of taking a pee break, and then they would continue to cycle. So that is how it was misused. And it is mainly abused by endurance runner, not by bodybuilders. The bodybuilders, they will use different types of anabolic hormones like stanozolol and all those things. Then thrombopoietin, it makes myeloid progenitor cells differentiate to megakaryocytes. So these are all different types of stimuli. Okay, so there are further many more. So you can look up your books to know more about these cells and these stimulants, because this is outside the course. So you can look into the slides later on. So this is all about the stem cells and the progenitors and granulocyte colony stimulating factors. And I hope you understood and liked. If there are any questions, please you can WhatsApp me, or you can ask and leave a comment in the live chat or offline chat. And stay safe, guys. And these are online classes just to protect you from COVID, because we have to minimize the physical interaction. And now we have good speed, we have good broadband out here, fiber is there, and presentations can be taken. So take care, guys, stay healthy, stay happy, and If you want to look at this lecture again, this lecture will be on my site, Health, Music and Fitness channel, and you can always come back and listen to it. There are many other useful topics on intermittent fasting and how to learn ECG. And now is the right time. You are in 8th semester, so you can start watching those videos and start learning. And if you want a special class to be taken live for you on ECGs, you can message me through your CR, and we can hold 1 or 2 classes, and it will be a blessing in disguise for you, and you will become masters of ECG. So thank you all. Take care. Bye bye. God bless.